Tonight, a concerning increase in COVID-19 cases across the country. The numbers going up, even here in Georgia.
Yesterday was the worst day on record in the United States, with more than 36,000 new cases reported. The Centers for Disease Control today said the true number of people infected could top 20 million. The agency's director estimating for every case they know about, there are 10 more people who have been infected. That information comes from looking at antibody tests. The rise in cases is especially bad out west and in the southeast. Here in Georgia, we have not hit a record, but cases are going up. The state has seen more than 1,700 new cases today. You can see the numbers heading up in this graph here. Today, the CDC also revised its list of high-risk groups.
Yeah, it noted that pregnant women are more likely to need hospital care due to complications with COVID-19 than other women. The study looked at medical data for more than 8,000 pregnant women who tested positive for COVID-19. They found a third were admitted to the hospital for treatment and were more likely to need mechanical ventilation. That's compared to only 6% for women who were not pregnant. The head of Emory University's OBGYN department says there's several reasons why this might be the case.
We'd expect that based on physiologic changes during pregnancy, adaptations to the respiratory system, the volume of the lungs is decreased as the uterus grows, and there are immunologic changes, all that make women more likely to have certain respiratory and viral diseases.
Well, the good news, the outcomes remain the same. Pregnant women are just as likely to recover along with their infants as other women. But Dr. Jamison says to avoid the stress and the risk, stay at home when you can, social distance when you can't, and wear a mask.